Hello everybody, Dr. John Dahlman, chiropractor in Grand Forks. And one of the most reliable tests that we can do as chiropractors is palpating your spine. And one of the best ways to find spinal misalignments is by looking for pain while we're palpating over the bone. So when a joint is dysfunctional, the skin of the bone becomes inflamed. And when the skin of the bone becomes inflamed, all we have to do is push on the joint and it's going to be tender to touch. So when you are thinking, well, how do I know if I'm out of alignment without going in to see a chiropractor? You can simply palpate the bones, the bumps right down the center of your spine, and you can push on them and move your head back and forth. You can reach onto the ones in your upper back, you can push on the ones in your low back, and some of them are going to be like very sharp and some of them won't hurt at all. So there is almost 90% correlation between pain on palpation of the bone and the joint being dysfunctional. So you come to a chiropractor, we lay you down or we do it seated, and we move the bones back and forth and we push on them and we ask, does this hurt? Does this hurt? Yeah, that one hurts. No, that one doesn't hurt. We find the ones that are in pain when we push on them and we determine the misalignment, and then we do a spinal adjustment in order to correct the misalignment. When we correct the misalignment, we then take the nerve pressure away, and if we repeat that process a number of times, eventually the inflammation to the skin of the bone will reduce and it will not be painful to push on any longer. Once again, it's Dr. John Dahlman, chiropractor in Grand Forks.